We have a question on our intake form of like, how many hours a day are you thinking about food? And oftentimes it's 12, 20 hours a day, just this sort of like mental drain that we see. That leaves clients in a obviously more emotionally vulnerable state where that's affecting their sleep and their relationships and their work. And so we see a lot of that trickle down.
Welcome to the Sandstone Professionals Podcast, where we help professionals achieve long-term successful outcomes for their clients. Welcome to the Sandstone Professionals Podcast with me, Clint Malley, and my co-host, Marina Vidrine. Marina, we're talking about something super interesting today, and it's something that people have asked us about over and over again. It's about eating disorders and really how it relates to addiction. And we have two amazing experts today who are going to walk us through the tough questions that people have when it comes to eating disorders and addiction. Abbey and Corrie, thank you so much for joining us on the podcast.
Thank you so much for having us. We're excited to be here.
Awesome. So Marina, can you tell us a little bit about our guest?
Yeah, Clint, I'm really excited for our guest today with us on the podcast. So we have Corrie Van Horne, who is an LPC and a registered dietitian. She is the co-founder of Omni Counseling and Nutrition, which is a practice that offers inclusive and relationally driven counseling and nutrition therapy. And their aim is to cultivate healing and liberation of the whole person. Specifically, Corrie is passionate about dispelling myths related to nutrition and supporting clients in dismantling internalized weight stigma and diet culture. And then we also have Abbey Gesing, who is a licensed professional counselor and works as a therapist at Omni Counseling and Nutrition. She is EMDR trained and passionate about working with folks at the intersection of their trauma, body image, and identity.
Thanks so much, Marina. Now, I think between the two of you guys, it seems like we have everything covered. So let's kick this off. Let's kind of set the stage, right? Let's talk about the basics, and then we can go in a little bit deeper. What does it mean to have disordered eating?
I guess I like to think of disordered eating as an umbrella term. Oftentimes we get sort of pigeonholed into thinking of eating disorders as, like anorexia or really clinically diagnostic disorders. But disordered eating actually shows up in a lot of folks that maybe don't meet diagnostic criteria for eating disorders. It could be restrictive eating, meaning they're not, someone's not eating specific foods or specific food groups. Could also be over obsession of clean eating or eating healthy foods. Can also be binge eating, eating large amounts of food in, one sitting. I don't know. Do you have anything to add to that?
I think to that point, it's something that is very normalized and often praised in our society. So it's oftentimes overlooked, and we sort of look at this is eating disorder. I don't do that. I don't have those behaviors, but there's a whole spectrum of disordered eating, dieting being the most common, which is, as we know, pretty normal in our society, but can be very, very harmful.
So it's not just, hey, I'm not eating enough, right? When we tend to think about disordered eating, it's like anorexia and bulimia, right? It's not just that. There's a variety of ways. It can be focusing too much on eating the right types of things or eating way too much, right? So there's what you're saying. It's just there might, in autism, there's a spectrum, right? Within disordered eating, there's this big spectrum, and people fall on different sides of that, right? With their relationship with food. Is that what you're saying?
Absolutely. Yeah.
Okay, so Abbey and Corrie, I'm interested in if there's a particular kind of person who might be more likely to develop an eating disorder than someone else.
I think that the stereotype is it's typically like thin white women that get eating disorders. But actually, if you look at like statistics, queer and trans folks are much higher, statistically speaking, to develop an eating disorder.
I think generally we see eating disorders affect all groups of people and socioeconomic status across worldwide, really. There's also a sort of myth that it's kind of an American disease or it's a upper class issue, and it's really seen across the world in many, many different populations. So while we do see it across all populations worldwide, there are certain things that may impact folks differently. Access to care, food insecurity, trauma, oppression, these types of things do have an impact on someone's likelihood of developing an eating disorder.
Yeah, I could see how when you're talking about the LGBTQ population or any population that gets like disproportionately amounts of trauma just for being themselves or walking around in their everyday lives, I could totally see how that could be a factor. And so, do you see trauma as being kind of a lens that we need to look at when we're thinking about eating disorders as maybe like a trigger or as the start of an eating disorder?
Absolutely. Yeah. Probably similar to addiction. Eating disorders are oftentimes coping mechanisms or, survival instincts that clients develop in order to just continue living, continue surviving. So eating disorder behavior helps people, get through their day to day and manage, oftentimes trauma or marginalization or oppression or things that have contributed just to, them feeling like they need some kind of coping.
Totally. And so I think that if you haven't had an eating disorder, sometimes it can be really hard to kind of understand that, right? Like to put yourself in the mindset of somebody who is obsessively thinking about food, about eating or not eating, or about their weight, right? So can you kind of paint the picture for us, what does it feel like to have an eating disorder? Like what's a typical day in the life like with somebody who has some unhealthy relationship with food?
Yeah, that's a good question. I think it's hard to say. Obviously, it's not a one size fits all experience. There's a lot of variety in between, even the spectrum of disordered eating to binge eating disorder, bulimia, anorexia, over-exercising. I think that one of the common things that I see with clients is this just mental and emotional energy being directed towards eating, restricting eating, exercise, sort of these behaviors that for a lot of folks feels like, okay, this is how I'm going to feel in control for the day, or this is how I'm going to cope, or make sure I'm quote unquote good today. But it ends up taking up so much. Like we have a question on our intake form of like, how many hours a day are you thinking about food? And oftentimes it's, 12, 20 hours a day. Obviously that varies, but just the sort of like mental drain that we see that leaves clients in a obviously more emotionally vulnerable state where that's affecting their sleep and their relationships and their work. And so we see a lot of that trickle down.
So I'm also interested in what are some of the factors that we could look out for that could contribute to someone developing an eating disorder?
I think definitely looking at trauma and trauma history, which, that may not always be something that's disclosed initially. So that might not be something that we can always sort of look at least initially. I think it's important to look at like marginalized identities, in particular queer and trans folks, also, people of color, and just the ways in which systemic racism and oppression sort of perpetuate fat phobia and essentially like, yeah, put like whiteness and thinness and heteronormativity as like the ultimate supreme, ways of being. And, that sort of causes oppression and marginalization that then leads to, potentially the development of disordered eating. So I think it's really important to look at systemic factors, and, also keeping an open mind around, like we've talked about, like how an eating disorder presents. And, for example, someone might come in who's been a chronic dieter and, that's pretty socially acceptable, socially normed, not something that we typically would look at with like red flags. But chronic dieting is like one of the main, or I think it's one of the top predictors of developing an eating disorder. So, in our society, dieting is, touted as sort of just like a normal way of existing. So,
and I would say even with children, I worked at Children's Hospital for a long time, and and I think this is across the medical field. I'm not trying to put them on blast, but like the way in which we even would talk about children's weight in front of them or weigh them or give them a healthy meal option because they didn't fit in this kind of arbitrary BMI range. And so things like that as a child and as an adult really do increase your risk of developing an eating disorder over time. I don't think it's like 4 or 5 times more likely if you're put on a diet as a kid. And so, it's just become one of those things that I hope clinicians will move towards screening and asking some of these like deeper questions around what their relationship with food and exercise has been like over the lifespan.
One of the things that you said that really stuck out to me was you're talking about kind of control, right? And when we think about marginalized communities, right, the Black community historically, right, like the LGBTQ community historically, there's so many things that are outside of your control, right? Like you can't control where you're born. You can't control, who you love, these kinds of things. And so being marginalized or being hated or whatever, based upon those things that are outside of your control can feel super frustrating. It could feel like I'm just trying to be me, right? And so I could see how an eating disorder could present itself as like, and really, I guess any addiction could present itself as like, I'm just trying to control something in my life. I need to have some semblance of order. And this is something that is actually within my control. And on the other hand, it seems like it'd be super challenging. I was just talking with a friend of mine the other day who was recently diagnosed with the eating disorder. And they were like, I can't. The thing about this disorder is it's, most of the time when you have like a addiction, there's abstinence. Just don't do the thing, right? Like don't use the substance. But with food, you can't do that. You need food to live, right? So like there's this constant trigger when it comes to just trying to actually figure out how to do moderation, because in general, sometimes we don't do so well in the gray zones, right? Like we like to have the black and white, do this or don't do this. So this next question, it kind of pulls to that, when we think about anorexia and bulimia, is that an addiction? Would we consider that an addiction, or is it, fall outside of the realm of addiction?
That's a good question. And probably one that I would say addiction and eating disorder professionals could sort of go round and round with. I guess my personal philosophy is that no, anorexia and bulimia or any eating disorder is not, they're not addictions. There are definitely a lot of similarities, but there are some distinct differences that, from my perspective, sort of, would keep them out of that sort of umbrella term of addiction. I do think they're all coping mechanisms and ways that people, learn to survive. And that's probably the similarity between addiction and eating disorders. But food in and of itself is not an addictive substance, and therefore there's, some differences in terms of like brain chemistry when it comes to addiction versus eating disorders.
Yeah. And I would say, I think we've both worked in both settings, in our careers, and they are sometimes treated as equivalent. And I think obviously what Corrie said about brain chemistry being different, we need food to survive. It's not something we can become addicted to. It doesn't deteriorate the brain in the same way that a drug or alcohol might. And we can't treat them the same way as like an abstinence model, or even sometimes saying eating in moderation is not, we have to kind of look at the underlying relationship to food and even like the mental restriction aspect. Our brains are very smart, and like even if we are mentally restricting ourselves, that can cause a fear of famine in a way that will push us to eat past our internal kind of intuitive place that we would stop normally.
Oftentimes clients will come in with like a, self sort of diagnosed food addiction, or feeling like they can't control themselves around food. And so I think it's important when working with clients that we really validate that experience and validate that it does feel addictive, and that like oftentimes they have this feeling that feels like they are addicted to, oftentimes people say they're addicted to sugar. But what we know through research and through science is that the body needs sugar. Brains and bodies are going to essentially crave things that we need. And so oftentimes restriction, or like when people aren't allowing themselves to eat carbs, or they're not allowing themselves to eat sugar, then it's going to lead to this, sort of intense feeling or intense craving towards that specific food or that specific food group, which then feels a lot like an addiction or addictive behavior. But the way that we would treat that is actually, introducing more of that food rather than like abstaining from it.
That's so interesting. That's very, very different than the addiction model of treatment, right? And so if you're seeing a client who's, like you're saying, self-diagnosing with food addiction, and you're working with them, so what you're saying is you will introduce more of a food that they're trying to resist.
Exactly.
It reminds me of like phobia almost training, right? Like you're afraid of spiders, introducing them the spiders so that that by interacting with that it's no longer becoming this daunting thing. Is there any connection between that? I wonder like if that's like related at all.
Yeah, I think we do end up doing some exposure therapy with clients especially around food that they are afraid of or feel like they can't trust themselves around, and working through like, how do you tolerate that anxiety? How can you like tune into your body and like sit with that feeling? So I guess in that way, sometimes it does feel a little bit like exposure related.
Totally.
With understanding that an eating disorder is not an addiction, I'm interested in what is the link then between people who may be struggling with a substance use disorder as well as disordered eating?
Yeah. So oftentimes, we talk about substance use disorders and eating disorders as like whack-a-mole, where like a client might be in treatment for their substance use disorder, and therefore they're abstaining from any substance use. And then, we start to see signs of a developing eating disorder, or even they may be going back to their eating disorder. That might look like restriction. When I was working in the addictions world, I saw a lot of folks that really like poured themselves into exercise and like being healthy. And, there is a fine line between that being a health promoting behavior and it being actually detrimental. So I think that's something to definitely look out for as addictions professionals. And then, we see that too with eating disorders. When, somebody's eating disorder is more under control, then substance use stuff might be, kind of popping up. So, they are definitely interconnected in terms of, being used as coping mechanisms and kind of swapping, behaviors out for each other.
Yeah, and on the flip side, I've definitely seen clients use substances as a way to cope or engage in their eating disorder behaviors. So they kind of work together in some ways.
There's a term called drunkorexia, which is, often essentially like people drinking in order to maintain restriction, or using alcohol as like a means to aid in their restriction. And I guess that would probably apply to other substances as well.
Well, just one quick question kind of in what you guys are talking about. So, Corrie, you were saying that, a client who might be recovering from substance use then might pour themselves into exercise and healthy eating. Is the line where that becomes unhealthy something that is up to the individual to decide, or is there some sort of criteria that you can say from the outside, this is now not healthy, now it's a problem?
I don't know that it would. I mean, yes, of course, the individual is the expert of themselves, and I think we need to trust that as clinicians. And it gets messy in that diet culture and fat phobia and, extreme exercise or clean eating are sort of culturally accepted things. So I do think it's the clinician's role to also intervene, or at least do, some educating around, what could potentially be disordered. And then also, talking with the client around, is this feeling like an obsession? Does this feel like it's compulsive or impulsive in any way? And I think just kind of sussing out, like, what is this behavior being used for? It's going to look different in every person, which makes it more challenging to kind of pinpoint.
Yeah, I think I'll speak to some of the things you can just notice as a clinician, or just what Corrie said, and also how is it affecting their self-esteem, self-worth, how sustainable are these behaviors for them? What are they doing? What are these behaviors doing for them? Are they distracting them, taking up time, community, self-esteem building? Like it's a gray area. Like Clint said, like we struggle in the gray area. And so it's important for us to be educated on that line and help them to understand what this is doing for them, and if it feels or is ultimately healthy for them in their recovery and in their life.
There's so many things that I feel like I want to unpack when it comes to this. And you kind of hinted at the fact that, okay, this is no longer doing the things that are supposed to be good, right? Like this is turning into something that is negatively affecting my life. And as you said, that this is going to be different for everybody. But, if I'm somebody who's like a concerned friend, or I'm a parent, or, I have a loved one, right? What are some of the patterns that I can look for in trying to say, like, okay, like maybe this person might need some support, like, are there any things that are generally true across eating disorders, or is it really, it's just every single person is completely different?
I think there are some things you can look for. I think this is a question we get a lot in my personal life too, for sure. Like, I will say up front, we definitely want to steer clear of using weight as an official marker of someone's health. A lot of times that's why many go undiagnosed, just because there's this like idea that there's a look to an eating disorder. So we want to focus on the behaviors, like you said. So rigidity in thinking is a big one. Noticing, like, is this person less flexible in their food choices, times of day that they can eat, who they will eat with. Are they isolating themselves during meals? Do you notice eating in secrecy? Those are just some of the behaviors off the top of my head. And then obviously with exercise, like how much time a day, again, with the rigidity of that. And then like, are they getting injured a lot? Are they pushing their body past what their body can handle? Those are a few I can think of.
I would add to that, if people are avoiding social situations that involve food, or like if someone's community and connection are impaired because of, their need to not eat or avoid eating situations, that's definitely something to look out for.
That does remind me a little bit of substance use, right? Of that whole addiction thing, right? So like on the one hand, okay, like I consume alcohol or, like marijuana or whatever, recreationally. Yes. Like this is something I do. I hang out with my friends. But then there's like the adverse side of it, right? Like you feel like you can't go into certain situations unless you're drunk or high, right? Like there's that, right? Or more commonly like, hey, like, I'm going to like pregame before I go hang out with people so I'm going to do these substances alone so that when I'm in this social situation, I can feel in control and at ease. Right. And so I could see how there is that parallel between those two types of thinkings and really kind of coming back to what you guys talked about first. I think Abbey, you mentioned it's about control, right? Like, and that rigidity of control becomes this all consuming thing that dictates my behavior instead of me doing this because it makes me feel good. It's kind of controlling me. Is that accurate?
Yeah, totally. So one of the questions I'll ask sometimes is like, well, how do you feel if you don't get to make it to the gym or you can't choose where you go out to eat ahead of time? Like kind of assessing for like how these situations cause emotional distress when things are changed at the last minute or there's not that control. I
just realized that these podcasts always end up being some sort of therapy for me. But I grew up in like a scarcity thing. So my parents were not present from the ages of like 5 till 13, right? Like there was nobody at the house, there was nobody bringing groceries. And so often what I would do is I would steal food. Like the privilege of being like a little white kid is you get to walk into there and eat some food in a grocery store and then leave. And nobody's saying anything. Or if they did, they didn't care, right? Like they weren't like, like get that kid. Or at school, stealing food, right? Like the lunch ladies weren't like trying to like catch me. They're like, this kid's hungry. We're just we're going to let him eat this food, right? But what it ended up doing for me was it made me be obsessive about food. So later on, as I got older and I got into like weight training and stuff, and I was, really into fitness, like food became this thing that was an obsession. Like I had to eat 6 times a day. I had to get such and such amount of protein. And like I found myself like thinking about, okay, if I go hang out with these people, but what am I going to eat? Or how am I going to bring my stuff to eat? Or even like subtle things when I would eat, I subconsciously would put my hand around the food like I was guarding it, right? Like, or being at a dinner situation and, subtly counting how many people are there and how much food's on the table, right? Like, and is that going to be enough? Even though I knew there's no way like that we would run out of food, but you're constantly thinking about, will I have enough? Is this enough? Right? Like, even when it was no longer an issue, when I had my own money, I could eat whatever I wanted. I found that, it took a long time for those triggers from that trauma to wear off, right? Like, and those patterns were not necessarily something that would be the same with other people who had lived in kind of like a food scarcity situation. But it was something that when I've talked with other people, they're like, yes, they can at least internally relate to that, right? Like, even if it's not something that they manifested, it was something that they were thinking about. And so I like how you drew the question like, hey, how do you feel when this is not the case? And in general, it seems like there's probably some anxiety around that. And if there's some anxiety around that, chances are we might have a problem. So is anxiety kind of like, this telltale sign like, hey, if you're feeling anxious about food in any way, maybe we should talk about that.
Yeah, like our bodies are smart. It sends us anxiety is communication. It's that, either whether it's actually happening or it's a past experience that our nervous system thinks is still happening, it's signaling to our brain that something's not safe or right or available. And our only job as humans is to stay alive. And so food is a huge part of that. And that's why it's important to ask more questions. Like, I wouldn't have known about your childhood, wouldn't have understood that's where some of those things come from without really digging into your relationship with food from a systemic lens.
Thanks for sharing that, Clint. I think it points to food insecurity, like Abbey mentioned earlier, and food scarcity, and how socioeconomic status can actually be something that, potentially contributes to the development of an eating disorder. Because food scarcity is, it basically is communicating to the body that there's a famine, and the body's response to a famine is to kind of like you were saying, Clint, take as much food as we can when we have access to it and hold on to it for dear life. Most all eating disorder behavior is extremely intuitive and actually really, makes a lot of sense.
And I think just even subtly understanding that, hey, listen, you're not crazy. Okay. This happened in your life or you're feeling this way because of situations. And I think, there is that stigma, there is that shame around addiction and around eating disorders, maybe another parallel between the two. That it's not something that people just talk about I love my coffee in the morning. It's no, when I have a substance use problem or eating addiction, it's not something that I tend to feel comfortable about. And so when you're able to say hey, this is kind of I get it. I understand what brought this about, because those are real feelings and those are real triggers and those are real responses that are actually natural for the body. I'm not saying that to justify it, like you said, but even just to say okay, now that you understand that, that's okay. We can also work on that not being the case, right? That there can be some hope and some healing through that kind of situation.
My job at Sandstone, a lot of it is doing aftercare planning for our clients. And we do see clients who are struggling with substance use and eating disorders. And something that's been interesting is in building aftercare plans, I talk to a lot of therapists. And I would say it's pretty common for me to speak to therapists who say, I don't work with people with eating disorders, and that's not someone I will see. Have you both encountered a sense in sort of the clinical community that eating disorders is something that's maybe intimidating or difficult to treat?
Yes.
Totally.
Yes, absolutely. You've been doing this longer than me, but I get the sense that a lot of clinicians feel like it's such a different thing to treat, that they need really highly specialized training for it. And while I do think that there's education and work that a clinician needs to do to be able to ethically and safely treat eating disorders, I wish that it wasn't so feared, because there's so many we're always dealing with dual diagnosis, in my opinion. There's never just one thing happening. And so that can be a little understandable. There are things you need to know and be equipped to do, but a little bit frustrating that it feels like we're so separate from the rest of the world.
And I will say, like Abbey said, for people who have meet diagnostic criteria for eating disorders, it's probably important that they do see someone who does have more specialization. And most people in our society have disordered eating. So I think for clinicians to be at least, educated and informed enough to screen for disordered eating, recognize disordered eating when it's showing up in their office, is really important, because it's much more widely prominent than people realize. So yeah, and I think, again, like Abbey said, like, yes, specialty education is probably important, and I think clinicians are more capable than they often realize they are in helping folks with eating disorders or disordered eating.
Absolutely. Absolutely. And could you just drill down for us one more time, specifically, what is the difference between an eating disorder and disordered eating?
Sure. So, an eating disorder is like very diagnostic. So if you're looking at the DSM and looking through diagnostic criteria for anorexia or bulimia or binge eating disorder or what have you, that's, an eating disorder is when someone meets those criteria. I would say by and large, there are many folks who have disordered eating, so maybe don't meet all the criteria for a full-blown eating disorder diagnosis, but show many signs of disordered eating. So I guess I would just say it's like the difference in, whether someone meets the diagnostic criteria or not. But it doesn't mean that disordered eating isn't something that should be treated and, acknowledged.
So someone with disordered eating is a licensed clinician could potentially work with, even if they don't have specialized training. Consultation and getting educated are always important things as clinicians. But I think, we all can probably speak to having someone come into our office and not feeling like we totally understand how to work with whatever they're presenting with. And, oftentimes it's more important that we maintain the relationship with the client than just, sort of sending them off to someone else. That's not always the case. Obviously, there are times when it's better for the client to be, to go work with someone that is more experienced in whatever particular thing it is. But I think oftentimes the relationship between the client and therapist is so important and crucial that, if clinicians can educate themselves and, do consultation, then I think people can be equipped to work with folks with disordered eating.
I will add to that, I did not have any specialized training before coming to Omni. That was all as I onboarded here. And part of that was doing my own therapy around my relationship with food and my body so that I wasn't perpetuating harmful stereotypes or promoting dieting or doing unethical things that just seem so normal in our society. So I would also encourage anybody who wants to work with disordered eating, yes, you're absolutely capable, and to get the right support and training to be the most helpful you can be for your clients and yourself. It changed my life. So there's that.
Yeah. And if you're a person who's trying to help somebody, everybody eats food, right? You're going to have to, if you're trying to help somebody, and as you talked about, there's a lot of people who have disordered eating, even a little bit of education seems like it would go a long way in just helping the person not to feel misunderstood. Even if you're not a professional or a clinician, or, you're not trying to give a clinical diagnosis, just having a general understanding of, hey, maybe you shouldn't do this, or maybe you should do this. Maybe you should ask questions. Maybe you should listen, can be a great tool to make sure that the person doesn't feel, you're not re-engaging some sort of trauma by passing this person off as something that's just kind of beyond help, even if it's not something that's your specialty. And I wanted to go to one more side of this. And you mentioned this earlier, and you're talking about kind of the relationship between alcohol and disordered eating. And I could see how there could be a whole host of reasons why alcohol could contribute to that, right? Like, I'm not going to make good food decisions if I'm drunk, right? Like, chances are, like, when I'm thinking about calories, like, that's why there's like this whole calorie mindset, like in these light beers, right? Because I want to make sure that I'm having the right amount of alcohol to feel what the effects, but at the same time, I don't want to mess up my calorie intake. Or if I think about these really old magazines that were really misogynistic, right? Like, by the patriarchy in regards to like the wine diet, right? Like, have coffee and wine as a way to kind of supplement your eating so that you can stay thin. Can you kind of just, give us a little bit of more of the relationship when it comes to the relationship between alcohol and eating disorders specifically?
Some clients might, I mentioned drunkorexia, like some clients might use alcohol as a way to help them restrict. So like drinking rather than eating, like drinking calories or getting all the calories from alcohol rather than having any food. I've also seen in clients like using alcohol as a way to help them purge. So if someone's using purging behavior, then like alcohol might be a means to sort of assist in that.
I think some of what we've already talked about just in like what people get emotionally from alcohol may end up helping with their eating disorder as well, whether it's to make them feel numb, to help them feel outside of their body so they don't have to feel their body or notice their body, to be social with other people and eat comfortably around other people. Mm-hmm. And then whether they go, purge or over-exercise or do something the next day varies. But I think it can, function as a way to either give permission to eat or to then help restrict in eating, and just to help with the emotional impacts that like alcohol does for people. It just varies for what alcohol is doing for the person.
Abbey, Corrie, thank you so much for taking the time and walking us through this really interesting and also very tricky topic, right? Where can people go to learn more about the work that you guys do?
Yeah, you can visit our website, which is Omni Counseling and Nutrition.com, where you can read about all of our amazing staff members. We have dietitians and therapists on staff. We also have some blog posts there and some more about our mission. We're also on Facebook and Instagram. Our Instagram handle is Omni Counseling Nutrition. And so we share a lot of great accounts to follow if you're looking to learn more about this and maybe even do a little bit of a like timeline, social media redirect to have some more body positive folks on there. And I think those are the main ways. Yep.
Awesome. We're going to make sure that we link to all of those things in the show notes in the description box so that you can learn more about Abbey and Corrie and about Omni and all the ways that they can help. I'm definitely going to follow this Instagram account. Now I'm like super interested in seeing these types of posts. Thank you guys so much again for being on the podcast.
Thank you so much for having us.
Thanks.
Hey, Marina, isn't Corrie and Abbey teaching a CEU event coming up?
Yeah, absolutely. They are doing a CE presentation with us on Friday, November 5th. That's going to be from noon Mountain Time until 2 p.m. It'll be a 2 CEU training. They're going to talk a lot about the information that we were just touching on in that how disordered eating shows up in addiction.
Cool. We'll put the sign up link for that in the description box so that you can check it out in the show notes. And listeners, watchers, we'll see you on the next episode. Bye. If you want to learn more or register for an upcoming Sandstone Care event, then go to sandstonecare.com/professionals/events, or just click the link in the description box or show notes.